Hello, this is Angelia, and you are listening to or watching the podcast Why You Do What You Do. The podcast that talks about human development and psychology to maybe help you figure out a little bit more about why you do what you do. Excuse me. And last time we were talking about sexual dysfunction and the problems, the people might have. And we're going to take back up on that a little bit. Some men suffering erectile dysfunction can be helped by treating the underlying causes or by adjusting medication. Sometimes your medication is making it so that you can't get one. Sildenafil, known as Viagra, taken in the form of pills, has been found safe and effective. Other treatments, each of which has both benefits and drawbacks, include a wraparound vacuum constrictive device, which draws blood into the penis. If we watched the, what was his name, Austin Powers movies, the Swedish penis pump. Injections of prostaglandin E1, a drug found in semen, which widens the arteries, and penile implant surgery. If there is no apparent physical problems, psychotherapy or sex therapy with the support and involvement of the partner may help. So, like I said, if there's no physical reason, sometimes it's up here. You're psyching yourself out, and your anxiety is up, and of course, that's not conducive to things going on. Concern with appearance and attractiveness. In a youth-oriented society such as the United States, and all you have to do is pick up a magazine to see that or look on the commercials, middle-aged people spend a great deal of time, effort, and money trying to look young. And there are people, I used to work at a place and they accused me of getting Botox, but it's called no. I moisturize, I use sunscreen, and I have good genes. Like I said, my grandma, one of them, she didn't get wrinkles or gray hair till she was 78 years old. So, don't hate, appreciate. However, research so far has not found an intervention that actually slows the rate of aging. So, all that stuff, it don't really slow it. Like I said, if you moisturize, and that's one thing she told me when I was 12 years old. She's like, oh, you're a woman now. So you have to moisturize. Because from now on, your skin's going to start drying out. Well, it probably didn't when I was in my teens, because I used to always have a breakout here. But, once you get in your 20s, I think that's a good time to start moisturizing. Because that's when you do start, the sebum that's coming out of you when you're a teenager and making all those lovely breakouts starts to dry up. So I think when you're about 20, it's time to start moisturizing. But that keeps your skin, more elastic. So, you don't look like a lizard and have a bunch of wrinkles. Now, some people don't mind. They don't care. They feel like this is who I am, and that's fine. I personally just, don't like dry skin. Dry skin itches me. I have allergies. And, you probably see me itching here, sitting here every now and again, and I'm just sitting here in a chair. So, just my clothes touch me wrong and it makes me itch. I don't know. But, I prefer to have softer skin just for me because it just feels better. Moisture skin feels better to me, More than 1.6 million people in 2001 had injections of Botox, a drug that has been found to temporarily smooth facial worry lines and frown lines by paralyzing the muscles that cause them. So, yeah, you're paralyzing muscles in your face when you have this done. No, thank you. Not for me. The drug wears off in a matter of months and needs to be repeated regularly. I heard when I'm joking at the place I worked that accused me of that. I had like a blemish right here, heaven forbid I should have a blemish. Oh my. But one whispered to the other girl, she's like, bad Botox injection? It's like, really? I'm sorry you are so insecure. Until recently, it was mostly women who fell prey to the relentless pursuit of youth. And that's because the youthfulness of a woman was so valued by men and other women that we felt like if we didn't look youthful, we had no value. As long ago as medieval times, a mature man was considered wise, whereas a mature woman was considered cold and dry. A societal standard that regards beauty as the exclusive presence of the young makes women especially vulnerable to the fear of aging. And we shouldn't be. Let's face it, women, you're going to get old, you're going to get gray hair, you're going to get wrinkles. It's a fact of life. You're going to get thicker. Deal with it. It's going to happen, Why struggle so hard to fight it, Just age gracefully. You don't have to purposely let yourself age, but you don't need to do everything you can to stop it, because you're not going to be able to stop it no matter what you do. The relentless social pressure to retain a slim, girlish figure make women self-conscious about their bodies. And let's face the facts. Once you start having children, you are not going to maintain that girlish figure. That's just a fact. Once you get to be a certain age, when you are, in high school, your body's still growing. In your 20s, sometimes your body's still growing. So, by the time you're 30, they call it the middle-age spread, but it's the fact that now you've stopped growing, and your metabolism starts going down, and a lot of us get thicker, with each child, estrogen's the fat-producing hormone, and after you have a child, your hips spread, because you're holding a baby in there. They're not that little trimness. They start to spread, as most women will tell you, subsequent babies are easier to come out. That's because your hips have spread to make that easier, and when they do that, that's just a fact of life. You can't just like get a clamp and a vice and put yourself smaller. So you're gonna go up in size. Chances are you're going to start getting a little bit of love handle in that, unless you're super conscious of diet and exercise, which some people are, and that's fine if that's what you're into, So let's just face the facts. That girlish figure is not going to stay. And if you stay slim, you're still not going to have the same measurements, because you're going to spread, and things are going to sag, and just it's not going to work. So just age gracefully and deal with it. Can be detrimental to the midlife woman's personal growth and sense of self-worth, because it is. If that's all you think about is the fact that you don't look like you did when you were 18, then that's pretty sad, because you're passing up all the wonderful things that you can do and can be, worrying about the fact you don't look like you did when you was 18. Today, the double standard of aging is waning, because people are starting to see that it's going to happen. It's going to happen to everybody, and because there is moisturizers, and women are trying a little harder, and men are trying a little harder to stay fit and healthy. People are just accepting we're getting older. Men too suffer from the premium placed on youth, because they're worried, about looking young for the workplace, looking young for the, wife or girlfriend or whoever. This is particularly true on the job market and the business world. It's not coincidence that anti-aging treatments for men have boomed in an era of corporate downsizing, because you know usually the folks near the top are older, and you know they don't want to be perceived as expendable compared to the younger folks. Men now spend as much as women on cosmetic products, and I didn't know that. You know, my husband uses some lotion because he gets like dry hands and stuff, but from working and then washing his hands. But you know, I didn't know men were doing that so much. You know, I knew a guy who used to wear some eyeliner, but other than that, and are turning to cosmetic surgery in greater numbers. So we've rubbed off on the guys. They feel like, you know, they have to have cosmetic surgery to get rid of those, you know, crow's feet, or, you know, put some padding here and there so they don't look, you know, sallow. Self-esteem suffers when people devalue their physical being. And of course it does. If that's all the value you place on yourself is the way you look, then that's pretty sad, because there's a lot more to you than the way you look, hopefully. On the other hand, an effort to maintain youth and vigor can be positive if it is not obsessive and reflects concern with health and fitness. Like I say, you know, taking care of yourself, eating right, exercising, those are good things to continue to do as you get older. But other things to fix yourself so you don't look so old, not so much, because chances are it's not going to help you. You know, it might help you for a little while, and then you start noticing something else that's wrong. And then, you know, I forget, there was this one woman that had like 56 surgeries or something. And it's like, that's crazy, you know. Just don't do that to yourself. Men and women who can stay as fit as possible while accepting realistically the changes taking place in themselves, because they're going to take place, whether you want them to or not. Sorry. And who can appreciate maturity as a positive achievement for both sexes, are better able to make the most of middle adulthood, because you're being mature. You're realizing, I'm getting older, fact of life, can't stop it, might as well, you know, do my best to maintain and enjoy it. A time when both physical and cognitive functioning are likely to be at an impressively high level. You know, you're at your physical and mental best at that level, and then we're going to start sliding down. Sorry to tell you that one too, but you probably already know. Health. A century ago, most people did not live through what we now call middle age. The average American died in their mid-40s, and that's just in, you know, 100 years ago. You live, you know, to be 40 some odd years old. So, you know, some of them folks you see died at this age. They had a good long life. Today, most middle-aged Americans, like middle-aged people in other industrial countries, are quite healthy. And that's because of modern medicine. All but 12% of 45 to 54-year-olds and 18% of 55 to 64-year-olds consider themselves in good or excellent health. That's because people know a little more. You start getting those little scare warnings, you know, and so you start trying to take care of yourself a little bit better. However, 23% of 45 to 64-year-olds are limited in activities because of chronic conditions such as arthritis, back problems, and rheumatism, which increase with age. So, you know, there's those of us who ain't out there running around. we're kind of hanging out and doing the best we can. Nutrition, smoking, alcohol and drug use, physical activity, and other influences continue to affect health in middle age. Because like I say, when you take care of yourself, you'll last longer, you know. And if you're not taking care of yourself and you're abusing yourself, you're not going to last as long. People who do not smoke, are not overweight, and exercise regularly at midlife not only live longer, but have shorter periods of disability at the end of their life. And now, you know, I was very athletic when I was younger. That might have led to some of my bone and joint problems. But in my 20s, me and my husband were pretty much couch potatoes. We didn't do a lot. I still did some exercise every now and then, but we didn't get out like we used to. So, that might have contributed too, to be really active and have a decade or two of not being active at all. So, middle-aged men and women who stop smoking reduce their risk of heart attack and stroke. So stop smoking. Unfortunately, leisure time physical activity diminishes rapidly with age, especially among people with low socioeconomic status. And that's because they can't afford the, athletic things that more affluent people do. They can't afford, the easier to pedal exercise bikes. They can't afford to go to the gym. They can't afford to, vacation out, in the wilderness and hike and, go on boats and things like that. So, they're just basically stuck at home. Besides SES, other indirect influences, such as race or ethnicity and gender, continue to affect your health. One important influence is stress, whose cumulative effects on both physical and mental health often begin to appear in middle age. Stress is the number one killer. It will give you heart attacks, strokes, keep your blood pressure up so that you're more prone to heart attacks and strokes. If you're a stress eater, you can have diabetes. If you have stress, it's an issue in your life. Deal with it. Don't just let it go. Deal with it. It's for your own good. Individual differences in personality and emotionality may affect how people physically weather the challenges of midlife, because we're all different. Some people are more emotional than others, and you're not going to deal with things so well if everything is a 4-alarm fire. So one of the things I told my family, everything's not a 4-alarm fire. It's just not. Now, if it is, then you can react like it is. But if we're talking about a 1-alarm fire, something's misplaced or whatever, that's not a 4-alarm fire. There's no reason to get stressed out or whatever. Just look till you find it. Health concerns. Despite their generally good health, many people in midlife are concerned about signs of potential decline. And like I say, I noticed the memory is not what it used to be. I got the readers here because my arm got too short to look at, read that small print. So, I started to decline fairly early, and I think that's because, like I said, I damaged my bones, and that's not good. Because I took no concern. I was, doing exercises on uneven march, smacking my hips and everything, and I have osteosclerosis. You don't get that by not doing anything. You get that by doing too much, and the bones start dying and falling apart. So, sometimes you wish you could go back in time and do things a little differently. They may have less energy than in their youth and are likely to experience occasional or chronic pains and fatigue. I just get up in pain. It's just a fact of my life. At any given moment, I'll have a headache, which could become a migraine. I got pain in my neck because I've had a slip disc, and I've got arthritis, and a pop and crack. I've got arthritis, and this shoulder really bad. I fell down the stairs and dislocated it. Got a little in this shoulder. The hands, again, I've had this one rebuilt, and had the carpal tunnel fixed, and ganglionic cyst taken out. I've got lung problems. I've had a few heart episodes. They don't like to call them heart attack episodes. I have the bad back where I have degenerative disc disease. I've had 4 slip discs. I have osteosclerosis in the top of my hip, arthritis, in there, deformed knee that I was born with, arthritis in there, arthritis in the others, in the ankles and the feet, ganglionic cysts in the feet, neuromas, and spurs. So, Every day when I get up, from the time I try and swing the body around and put the feet on the floor, I already know it's going to be a pain day. But it just depends what level of pain. And I've learned I can take more and more. You know, it used to be just one little pain, ow, you know, bad. But now I just have to struggle through it because it's not going to go away. You know, they can't replace your whole skeleton, but it is what it is. So I'm up here every day doing what I can do. Middle-aged men and women who stop smoking reduce their risk of heart disease and stroke. Yeah, okay, where do we go here? One important influence is, yeah, we did that. Okay. Yeah, they may have less energy than in their youth and are likely to experience occasional or chronic pains and fatigue. They can no longer burn the midnight oil with ease. They are more likely to contract certain diseases. And now my husband, when he was younger, he used to stay out at the bar he liked to frequent with his buddy. And his wife even sometimes. I went, no, that wasn't for me. But he would stay out till 4 in the morning, come home, get it like an hour and a half sleep, go back to work at 6. So, you know, he gets to bed now like at 9:30, so and gets up at 7. So, you know, it does change things as you get older. You can't do these things anymore. I haven't been able to do mornings really in a long time because I'm so tired, you know, and I wake up and I might look at the clock and see an early hour, but then the eyes go, you know, back down, and then, I mean, you know, it's just my life. They take longer to recover from illness or extreme exertion. My husband, like I said, extremely exerted himself and had a stroke. So, you know, you can't do all those things you used to do when you were young. Hypertension. Chronically high blood pressure is an increasingly important concern from midlife on. So if your blood pressure is high, you need to take that seriously because that leads to heart attacks, that leads to strokes. And if you want to be around for your family and friends, you need to take care of that. The medicines they got for that nowadays are pretty good. I take one. My husband takes 2. My elderly father, I forget how many he takes. And my elderly mother-in-law also takes a bunch of medications to help with blood pressure. So, you know, you're in good company. And if your blood pressure is high, take your medicine. It'll save your life. It is the most common chronic condition among 45 to 64-year-old men and second most common after arthritis in women in that age group. So we start getting arthritis a little sooner than the fellas, and you know, I've heard women say that's because we do more than them. But you know, there are men who work very hard at their jobs, work very physical jobs. So, you know, that's not always the case. Blood pressure screening, low salt diets, and medication have reduced the prevalence of hypertension, but it still affects about 34% of men and 25% of women aged 45 to 54, and more than 40% of both men and women ages 55 to 64. So as you get older, the prevalence of high blood pressure goes up. So like I say, when you start noticing this, when they say hey, blood pressure high, go ahead, they'll probably give you meds. Go ahead and take them. You know, don't say, oh, I don't need those I don't. No, take them. You do need those because it's only going to keep going up as you get older. And if you're not taking the meds, you're risking your own life. You're going to give yourself heart attacks, strokes. Take the meds. People in the latter age group have a 90% risk of becoming hypertensive eventually. So, latter age group. So, we're talking about the folks, you know, out of middle age. We're talking about, you know, 70s, 80s, 90s, and older. You got a 90% chance of hypertension when you're really old because it's going to happen. Your arteries are going to get hardened, and it's just going to happen because the body's only going to go so long. So take the meds, save your life. As life has lengthened, the leading causes of death have changed. Like back in the day, the leading causes of death might have been gout. There were a lot of people who died of gout back in, the Middle Ages. And, nowadays that's something that's, we know the diet is the number one cause there. You can stop the diet. And, there are also, medications and treatments to help with that. So rarely does anyone die of the gout nowadays. In the early 20th century, people commonly died of infectious diseases and epidemics. And remember, so-and-so lived through the Spanish flu and Legionnaire's disease and all this. We had epidemics and things. We just had our little pandemic not that long ago of the COVID. And, these things happen every now and then and wipe out a little chunk of people. Just happens. Today, the two leading causes of death between ages 45 and 64 are diseases related to aging, such as cancer and heart disease. However, death rates have declined sharply since the 1970s for people in this age bracket, and that's because of modern medicine, because of the statins and the blood pressure medicines and things, that can help you. And also because of education about smoking and drinking and drugs, that can lead to cancer. So, since the 70s, people have been paying a little more attention to the Surgeon General's warnings and stopped poisoning themselves so much. In large part because of the decline in deaths from coronary heart disease due to improvement in treatment of heart attack patients. And they got the clot buster. You ever have a heart attack, you're going to have this little thing called a clot buster. They can put it in you, and like within a few minutes, you're going to be like, you're going to feel so much better. About 1/3 of recorded cases of AIDS in adults are in people over 40. And that's because they were, younger when this thing started. And 10 to 15% of cases occur in people over 50. So the number goes down as you get older, and again, safe sex is your number one, preventative for that one. Many patients in this age group contracted the disease through contaminated blood transfusion before routine screening began in 1985. So, like I said, when it was its heyday, a lot of people were getting it and not even knowing they had it. And diagnosis often does not occur until a late stage of infection. There's people who probably had it for 20 years and didn't even know until things started happening. The disease tends to be more severe and to progress more rapidly in middle-aged and older people whose immune systems may be weakened. So if you're older, don't think, you can, just because you can't get pregnant anymore, you can just bounce around partner to partner, because you're more susceptible to diseases. So again, if you're having different partners, you want to practice safe sex, especially if you're a middle-aged person. National, I'm not going to worry about that. Okay. Diabetes is the 7th leading cause of death in middle age. I am pre-diabetic, and my mother died of complications of diabetes. My grandmother died of complications of diabetes. I had a great aunt who did the same thing. So that's something that I'm trying to watch, and keep that A1C down. But it does get harder as you get older. The most common type, mature onset, type 2 diabetes, typically develops after age 30 and becomes more prevalent with age. Unlike juvenile onset or insulin-dependent diabetes, in which the level of blood sugar rises because the body does not produce enough insulin, In mature onset diabetes, glucose levels rise because the cells lose their ability to use the insulin the body produces. As a result, the body may try to compensate by producing too much insulin. People with mature onset diabetes often do not realize it until they develop such serious complications as heart disease, stroke, blindness, kidney disease, or loss of limbs. Because, not a whole bunch of people have that nowadays because of better treatments. But, I had a great grandma that had a problem. She had an infection and everything, and she got gangrene in her leg, and they cut off her leg. And there were stories of people, back generations before her who would have to have like a foot cut off or something like that because it would get, the gangrene and everything. And I mean, that's crazy scary. So, trying to keep the sugar down to a minimum. It's hard because it's an addiction. Your brain likes it. Feels good when you eat it. So, trying to control that. Let's see. Preventative care can stave off or even prevent some diseases. For example, early treatment can lower elevated pressure in the eye and delay onset of glaucoma, a major cause of blindness. And that's why when you go for eye checkup and they blow the little thing in there and you're like, why? But that can help figure that out. And they do the little thing where they look in there, so take care of yourself so you can last as long as you can. That's where I'm going to leave you today. I hope this helped you figure out maybe a little bit more about why you do what you do. Please like and share this educational program so we can spread it around the world. Thanks for watching. If you want to help me out, subscribe to my YouTube channel. If you want to help me out even more, go to my Patreon page and become a patron. That's all for now. Until next time.